So just to quickly condense what you have put forward as a concern now, some of the changes involve shifting and in fact, moving entirely a lot of inpatient services in South Muskoka and Bracebridge. And I see this is one of the major concerns that you have with this proposed model. So the question is, why is this a concern for you and your fellow doctors that have signed on this call to action?
Well, is this this letter which we sent is a unanimous letter from all the medical professionals working in South Muskoka Memorial, and we're all very concerned with this new model for many reasons. One of the main reasons is this day and age, when we're talking about expanding our health facilities and having more and more stuff done in the hospitals, instead, this model proposes significant reduction in facilities to the point that there would be no inpatient services for local people except 18 beds. That is for a short stay procedures, probably from surgery, and not for people who need to be admitted for other medical issues. What they're talking about is 4 ICU beds, which are actually, again, sort of a transition bed. They're not proper ICU beds. So that limits our capability of looking after very sick people or people who need prolonged admissions or to do major surgeries, because those surgeries are on people who are sicker and need prolonged admissions and ICU stays. When you don't have that backup, you're limiting yourself to just a day or ambulatory care. And so our concern is, if this new model, which is proposed, goes ahead, we will be just a sort of an ambulatory care with insufficient services to look after our growing and getting older population.
Now,
we also feel very strongly, if that is the case, we don't have any real inpatient services. Most of the surgeries and other procedures which they are proposing to be done here will not practically be feasible, because down the road we will find out that it's not feasible to do them, because many of these outcomes are unpredictable when we operate on these people. They need to be admitted and they need to be shifted to ICU, or they need more intense care. And we feel that it might just land up being, okay, it's not working, just move to the hospital where this works. So it will just go to the other hospital. And most disturbing issue for us is that with this model, we will not be able to attract any new specialists. We'll be not able to even retain our specialists. What to talk about our family doctors? Nobody will be willing to work in an environment where there's no real backup, or there's no real support. And I think the percolating effect will be on the community. When the community sees there is no real hospital here to look after, they start not moving in there or start moving out. So it's like, it's
a compounding issue.
Downward spiral you're getting into. And I think the hospital is a major hub and a major center for a community to rely upon. When you're losing that, it's just a big disaster.
So I understand the concerns; it's very legitimate. One of the points that I didn't see in your letter that I wanted to highlight and get your response to is that the MAHC explanation to the reason for this was the inflationary cost of this build is about 50% more, so about $500 million more necessary to build both of these sites. Obviously, that cannot happen. The community is already struggling at 225 to pull that together. So they have come up with this model to deal with that. What is your response to that?
Well, no, we see their point with inflation and all this cost escalating. We see that. We're not necessarily saying that the administration is proposing something which is not keeping in line with the reality. But at the end of the day, we think if we lose the hospital, it's just a disaster for the community. And if we do that, there will be no hospital for the next 15 years, not at least 50 years, not to talk about any expansion. So if we cannot have a real hospital in 50 years, we're not seeing how this community is going to progress. So yes, the costs and other inflation, I know they're there, but I think if there's a will, there's a way. If there is politicians or others, people involved, they can look into it. But just because we have a certain amount of money and we just get away with this hospital is the option, I'm not sure really seeing the point in that.
So what, I guess the question is, what do you see as a solution moving forward then? How do we work within this budgetary confine that we're in, but still make sure that we're not losing the services like you're saying in Bracebridge?
Well, first of all, we need to see how they're saving the money with this new model because to us, they're still duplicating the services because one hospital is being ambulatory with all the day surgery, but the other hospital also has the same facility. They're duplicating. They're having endoscopy in both sides. They're having surgeries both sides. They're having cardiac facilities both sides. They're having imaging both sides. So I'm not sure they are single-siding services to save the money. They're just cutting the square feet in one hospital to save the money. Is that really a cost saving in the long term? We don't know that. We don't feel that way because then you will have to have extra transport, taking patients from one side to the other side all the time, 24/7. That will be a lot of money. I think overall, this model will not save any money. It might be a small save of some money save with a construction point, but not overall. That's what we think. As far as what should we do, I think the message is loud and clear that if the money is not enough, then the ministry needs to look into it and have more money rather than just being saying, okay, we don't have money, just work in that. Just get more money, or ministry needs to get involved. We need to have a moment where people can have their healthcare taken care of locally rather than going up the highway or down the highway for long distances.
Now, part of this letter you sent out is obviously a call to action to the community. What would you like to say to the community as part of this?
I think the community needs to know the real impact which will happen if this model goes ahead, rather than not seeing exactly what could happen, because the way it is proposed might not be the way it will turn out to be. That's what we suspect, and that what we think will happen. So we as a community need to get together and get to the higher authorities to say, okay, well, this model doesn't work for us, and we need to mitigate this situation with maybe more money or maybe some other approaches. We don't know what, or maybe status quo.